Good afternoon and welcome to the SAIS Foreign Policy Institute's Coffee Hour. My name is Kristina Spohr and I am the Helmut Schmidt Distinguished Visiting Professor at Johns Hopkins SAIS in Washington, D.C. Today I will be discussing Europe's response to the COVID-19 crisis with the SAIS experts Daniel Hamilton and Cengiz Günay. Daniel Hamilton is the SAIS professor and senior fellow at the Foreign Policy Institute here in Washington and spending some time this spring as Richard von Weizsäcker fellow at the Bosch Academy in Berlin. He is, as he says, in excellent hibernation in the German capital. Cengiz Günay is deputy director of the Austrian Institutes for International Affairs and a lecturer at the University of Vienna. In 2018-19, he was an Austrian Marshall Plan Fellow at the FPI at SAIS in Washington, D.C. His research is focused on Turkey and the Middle East, and he is currently in his home office in the Austrian capital. So, gentlemen, how does Europe cope with COVID? How did you experience the sudden lockdown in your respective countries, and how has it progressed? Perhaps you can also say a little bit about how you felt decisions were communicated by the leaders or by medical experts. And how often are there press conferences? Have you found them useful? What is the difference between a federal state and perhaps a more centralized state? Cengiz, do you want to start?
Okay, thank you. Hi, everyone. Hi, Kristina. Hi, Dan. I think it was a surprise when the government decided to go for a confinement, as probably in all countries. It was also a surprise here. And it started actually with the universities. The universities were shut down on Wednesday. In March, that was March 11th or so, and on March 13th, the government decided to go for a general confinement, which means that all shops except for supermarkets had been closed until recently. After Easter, small shops were allowed to reopen. I think the government did a pretty good job. That's the general feeling. If you look at the, as you might know, it's a coalition government, a quite unusual one between a conservative party and the Greens. And the coalition government was just formed a couple of months ago. So they really found themselves in the middle of this crisis at an early time of their coalition government. And the general approval rates have gone significantly up over the last weeks, particularly also for the Greens, because the health minister is from the Green Party and he's very prominent in the press conferences. And he's always next to the Prime Minister. So you always have the Chancellor, the Minister of Interior, the Health Minister and the Vice Chancellor appearing on TV, generally weekly, and they're telling the public about the next measures that are going to be taken. No experts in sight so far. They're talking about anonymous experts, and that has been also criticized in the media here, that whereas in other countries, for instance, in the US, you would see doctors and health experts next to President Trump. In Austria, it's only the chancellor, more or less, and the health minister that are the experts in the public. And the chancellor doesn't really like a lot of criticism. And there was a case of one of these anonymous experts who left the experts board after a disagreement over how to deal with confinement regarding to public parks.
Dan, how was it in Germany?
Well, Austria was first, I think, in Europe, and so I think many were looking to see what the Austrians were doing. The Germans didn't quite go as quickly, but most of the developments in Europe were 2-3 weeks ahead of those in the United States. So I think for Americans looking at this, you can see conversations the Europeans are having are a few weeks ahead of the ones Americans are having. I think in Germany, Chancellor Merkel has gotten quite high marks for her handling of the crisis so far. She appeared on television and gave a progress report last night, basically said in her sort of way, we've made pretty good intermediate progress, but it's very fragile, and we have to be very careful. So there are moves now to reopen some of the shops, small shops, and to move ahead in probably on May 4th with some schools, but only classes that have to take sort of final exams. So like senior classes of the leading high schools and sort of intermediate schools to the elementary level that will be taking important tests. And otherwise, they're trying to limit it. They have shut down all mass gatherings until the end of August and are still keeping distancing guidelines. It's not mandatory to wear masks, but it's heavily recommended. I think Germany is the largest economy in the world that's on complete lockdown. The United States, is not really as a national government. And so getting the German economy back online, it will be important. But the German society, I think, has gone along pretty well with much of this. There's sort of a sober attitude here. There's not a lot of bickering. There's some debate now about the schools, whether each state in Germany will actually implement that idea of starting in early May. I think some will probably delay it more. There's some concern about, sanitary issues in schools and how will they take care of that. But otherwise, people are keeping pretty much to the guidelines. There are heavy fines here if you are out not where you're supposed to be. Up to 5,000 euros you could be charged if you're just sort of driving around on a driving spree and you're not supposed to be where you are. So it's a sober mood, but not one where people are saying there's a problem. And I think the coalition government also has gotten high marks, and all of the ratings for the chancellor and for her party have gone way up.
Could you perhaps, for the American audience, explain a little bit the difference that, for example, has been highlighted in Europe? In France, you see a very centralized approach by the Macron government, even in Brexit Britain, although the Prime Minister is very ill. Again, you see something that is very centralized. Everything is run through the National Health Service. In Germany, of course, other that it's sort of put forward as one of the countries that has done massive testing. How much do you think is that tied to, in some ways, a benign tension between the central government and the authorities that is being held by the different Länder? In other words, on the one hand, of course, Merkel has the problem that she has to get the ministers of the Länder together, but on the other hand, the devolution of power perhaps has also some positives in the running of the crisis. Could you perhaps comment on that briefly?
Sure. Germany is a federal state, sort of like the United States. It has 16 states as opposed to 50 states in the United States. So the German governors, what they call the minister presidents, are quite powerful and have a lot of authority over health issues, over education and other areas where these are sort of the frontline issues. I think when the crisis hit, Germany did not do well in that regard, as much of Europe did not do well. Everyone scrambled, and you saw each local, regional, and national officials sort of decide all sorts of different things. Bavaria went, southern Germany went quickly to a lockdown situation, whereas the other states had not. So, and I think you saw that all over Europe. There was a massive scramble. Everyone doing things in different, there was no coordination, whatever. Everyone ignored the European Union authorities. There was no sharing of critical supplies. Everyone was hoarding for themselves. And you still see that, you have this outlier in Sweden where they never went to lockdown. And now the Swedish infection rate and the death rate is multiple times its neighbors, which forced Finland, for instance, to close its borders with Sweden, sort of unheard of. And a lot of things you've seen throughout Europe, the centralized authority in France, and Macron using sort of war terminology, much like the President Trump has done, you can imagine has a very different resonance if you would use that in Germany, a country that was destroyed by wars it started. But that type of wording doesn't go well in this country. So Chancellor Merkel's been very straightforward. Her communication style, she is a scientist, has been quite factual. She was the one last night, for instance, gave very impressive discussion to her countrymen, said, the rate of infection right now is about one person who has the disease will infect one other person. If that continues, we'll be at a capacity with our beds and everything in October. So we need to get that down. If it goes up by just 0.1%, our bed capacity will be exhausted already in July. And if it just goes up by 2.2%, 1.3, infected people will be exhausted already in June. And she sort of just explained it this way, very matter of fact, that that's why I'm asking you all, we have to get this rate down. These are things we need to do. I think in the United States, you see that the doctors were doing that in the White House briefings, but the president was not doing anything like that. So you see a real contrast in styles between the German chancellor and some other national leaders.
Thank you. I mean, of course, like you say, we see a German chancellor who's quite pragmatic in a similar way. We see the Finnish prime minister taking a very similar approach. Macron, much more, in that sense, presidential, aware of his power, talking about war. A bit similar, we see also, of course, in Spain, whereas President Trump, although he talks a lot on the platform, actually tries to avoid real use of power because he tries to avoid responsibility. Nevertheless, all these different styles, of course, raise a question which I want to go to Cengiz, namely the question how important, especially also in Europe, has been references to civil liberties when it came to the lockdown discourse, and also the exit strategy that we are now beginning to see, especially in the smaller countries where, of course, you have a bit better oversight of numbers and peoples. And of course, that raises the question in terms of when we think about coming out, how do we reduce again this state power? And what are the dangers of democracy when the use of power gets so ingrained? And perhaps as you talk about Austria, and maybe you can make a couple of references to some of its neighbors, you can also give us the example of an authoritarian neighboring state of Turkey. To you, Cengiz.
Okay, thank you. I think that's a big, let's say, challenge. These kind of situations have become a challenge for democracy and also civil liberties, because somehow there is a discourse, and that's not only for authoritarian countries, but you find it also in other places, that as if democracy, democratic procedures, decision-making mechanisms, and so on, are an obstacle for speedy decisions. And this is, I think, a very dangerous development you can see across the globe. So as if it suggests as if in extraordinary situations, you need extraordinary measures that are beyond democratic control and beyond democratic procedures. And I think we can see these kind of things, developments right now as well. You mentioned Macron, who has kind of defined the war against coronavirus as a war, and which is also kind of legitimizing extraordinary measures. And you would also find the same in Austria, where the government passed a couple of quite restrictive and controversial laws, also with the help of the opposition through parliament. And now that some opposition parties kind of felt uneasy with these decisions, because it's not clear like how long they're going to last and things like that. It turned out that most of them would not stand at the Constitutional Court. And the Chancellor's reaction was, actually, I don't care. This was done in response to an imminent crisis. and until the Constitutional Court will decide, it won't be necessary to keep these measures alive anyway. So I think this is a kind of sloppy approach to not only to democracy but also to the rule of law, and you would see even more drastic developments, as you mentioned, neighboring countries. Hungary is a good example for that, where the government, the Orban government, passed an emergency law that is restricting or very much narrowing down the democratic space. And I'm really appalled by the non-reaction from the European side. I think this is a very dangerous step, and neither the Austrian government, the chancellor, refused to react to it. He said this is one of his least problems right now. Nor the European Commission reacted in my opinion, in the necessary way to it. And similar developments, even more dramatic, you would also find in Turkey, where in Turkey it's not anymore the question of even further authoritarianism is the fear, because it has already taken a very authoritarian turn in the country over the last 4 years. It is interesting to see how these kind of new authoritarian regimes deal with a crisis as this one. It is intransparent. It is hiding and concealing the real numbers. And so you have a lot of contradictory informations about the real situation in Turkey, whereas the government keeps the numbers very low and doesn't want to give the feeling as if their response was too late. Oppositional forces, movements, news channels, and so on circulate completely different numbers. And it's really difficult to tell what's the real situation in the hospitals right now, which makes also a kind of the struggle against this virus more difficult in the Turkish context.
To bring in Dan, how do you see the relationship between the EU's federal organs, if we so want, and the national governments? I mean, both when it came to the lockdown measures and border closures, the Europe-wide medical stockpile questions, PPE purchases, production and distribution, the race for medicines and vaccines. And perhaps you can also bring in something, is it benign or hostile competition in policy approaches between EU states? And what can be said about the relationship as it has evolved in this crisis between France, Germany, and Italy, for example? I'm thinking here, perhaps you can illuminate for the audience this transfer of patients between countries. What I'm trying to get to really is also this question. Often the EU gets blamed that the supranational bodies are so powerful. That, of course, was part of this Brexit debate. But contrary to what anti-EU voices always say, it seems to be almost the opposite, that instead of there being too much diktat from Brussels, now there seems to be too little or too late.
Thank you. Well, under the European Union treaties, the European Union, the Commission doesn't have any authority over health issues, so it's still a national competence. So that's one thing why they're not doing a whole lot. But as I mentioned earlier, in the middle of the crisis, every country just was trying to take care of its own. So all of that solidarity went out the window immediately. It was even the case within countries where countries were doing the same to other regions. So I don't think it was anything direct to the EU. It was simply a mass scramble. And Italy, was really the super spreader, and unfortunately, so many people there have died. It's gone to other countries as well. But the notion that other EU countries would help Italy became a huge flashpoint, and all the worst stereotypes that one has of Europeans and how they think about each other came out. Basically, the Italians pleading for help and complaining about a lack of solidarity, what it even means to have a European Union when no one's helping them, versus sort of stereotypes in much of Northern Europe that these countries always bring it on themselves. It's their fault because they have poor infrastructure and they're lax and they're medical issues and just basically everything ugly came out. It was the ugly side of the EU. I think what they're trying to do now is they're thinking about getting out of the lockdown and devising exit strategies. The EU is trying to have more of a role so that it's done in some coordinated way. But again, they really don't have a whole lot to say here. The Commission just released a paper together with the European Council, so that's an unusual document where both the member states and the Commission, the bureaucracy, issue a common document about guidelines, ways that one could coordinate. But in the end, each country is going to do what it wants to do. There does seem to be a little more. I think where the EU will come in is the economic recovery. So that's where they can bring a lot of funds to bear, a lot of money. And there again, there's been this ugly debate about what the Italians are calling Corona bonds. That is the idea that members of the Eurozone should mutualize their debt, that debt should be common to all members of the Eurozone. That's been an idea that's been around for many, many years, even before the financial crisis of 2008. And that's always been rejected again by sort of the frugal Northerners, and it was rejected again. So I don't see that that's going to come about. But what they are doing is a massive injection of funds through what's called the European Stability Mechanism, which is through the Eurozone. There's an interesting experiment, I think, for Americans to look at is many countries are going, instead of firing people or furloughing people, as happens in the United States, they are many companies putting people on short-term work. So you just work part of a week. You don't work the full time, you don't get paid that full time, you get paid part-time, but at least you're getting paid something and you work a little bit. And that is less cost to companies, it's less of a burden to any employer, and you're still, you're still employed. They did that with great success, in relative terms during the financial crisis in some European countries. And so you don't have this bust and boom situation with massive unemployment that you do in the United States. And they're doing that. The idea is whether the EU would support that financially as a common sort of approach. And then they are doing a lot of things. There are a lot of rules on you can't have deficits in the Eurozone and this. They got rid of all those rules for right now. You can't have government intervene in the economy. They loosened all of those rules. So they've done quite a bit. And the biggest, I think, debate now coming is about what's basically the EU budget for the next 6 years. They were already debating this. This is the time when they have to decide common funds they do it for a 6-year stretch under what they call a multi-annual financial framework. And so there's a real debate now whether they front load a lot of money that was intended over 6 years and say do it in 3 years, realizing 3 years later you won't have much money, but that's not the problem. The crisis is now. And so there could be a whole infusion of, lots and lots of money through this EU budget. But that's, again, the debate of who gets it and how does it, split.
Yeah, very interesting. I mean, one of the big differences is, of course, from Europe to the United States, for example, precisely that in some ways it's tied to the welfare state, that people don't get made redundant, but because, of course, even if they keep their jobs part-time, they keep their health insurance, they keep their pensions. And of course, once you start rolling out the economy again, you don't have to start going to look for a new job and start all over again. In some ways, it sort of allows for a certain continuity as long as it can be paid for, of course. Now, in terms of when we look to the future, Cengiz, what do you think is sort of the role and the challenges for the EU, also when you think about Austria's southern neighbors and the circumstances on the Balkans?
I think one of the major challenges is, and this will have a long-term effect, that this crisis has kind of shifted the perspective from a European perspective again back to a nation state perspective. And I think that will be really difficult to overcome, also with the financial burdens the single member states have kind of taken on over these last weeks, and also the different type of national economies and the different responses to these economic effects of the crisis in the single member states. That might be a bigger challenge, and to gain back the European perspective and the common strategy out of this crisis. Of course, in every challenge, there's also a chance. I see that, I hope that the member states and also the national and nationalist governments in some of the countries will understand that it will be much easier to tackle these challenges together on a European basis. So it's difficult to tell from this point now which of these two options will prevail, but I hope that that people will find back to a European perspective. And as regarding the enlargement process, this process has been in trouble for quite a time, and I think this crisis has only kind of deepened the already existing problems or made them even more visible. Concerning, when you look from the Western Balkans, which are really in the close neighborhood of Austria, when you look at the European Union, you don't see a common European strategy. I think this is one of the major disadvantages of the EU in this region. It could not kind of develop a common European, like also from outside seen, a common European perspective, how to tackle a challenge together. Another thing is that you have more and more other actors coming in, whereas the European Union was very hesitant, and it lost also ground because of this export ban for medical items. The export of medical items outside the European Union was forbidden by the Commission, and this was also the case for candidate countries, and that was not very well received. And this vacuum was kind of filled by other actors such as China. So you would have, particularly in countries as Serbia, a further shifting away from Europe and the EU towards other international actors such as China, that kind of promise a more effective dealing with the crisis. And it's also a more authoritarian model there, also, of course, suggesting in that regard.
Yeah, I would like to push down a little bit on that, what his view is, being in Europe. You know, how do you see China's recent health diplomacy push into Europe and around the world? And how do you think that also affects Euro-Atlantic relations during this crisis and beyond? And after this question, I will ask you both just one final point.
Well, I think it's been mixed. I think the Chinese seized on the idea that they're delivering all of these materials to Italy and other countries and got a lot of good positive media. But part of it is, you know, Germany and other countries have delivered much, much more in terms of equipment to other European countries than China. It just doesn't get reported well. They do a very bad job of their public diplomacy, if you will. And so that's been a problem. And I think the other thing is that many of the masks, some of the things delivered to countries were turned back. The Spanish sent them all back to China because everything was defective. So that wasn't so good for the Chinese. And I think people are, you know, they're not fooled by some of this, and they see it for what it is. So I think it's a very mixed picture. It hasn't been necessarily all that positive.
Thank you. So last question to both of you. I would just like one line. So how do you see the future of international cooperation as we move out of this crisis? Because of course, you know, there have been already systemic shifts, which perhaps this pandemic brings out all the more for. What is the future for international cooperation?
Dan, would you like to go first?
Well, I think it's difficult, obviously. I think you see, on the other hand, on one hand, an unparalleled effort to cooperate across borders to find a vaccine. There's medical scientific collaboration that we've never seen in history. So that's really unparalleled. It's quite something. You know, there were similar efforts about HIV/AIDS and SARS and Ebola. Those all took years. This is probably going to just take months, even though we're all impatient. It's record time. So you see things that are quite interesting like that. And then you see, on the other hand, you see internet trolls and cyber hackers taking advantage of this space that's left here. The WHO has even called out Russia for what they call the infodemic. So disinformation during the pandemic, all sorts of crazy stories about conspiracies and things. So the state, contest, if you will, competition is still around, and some groups are trying to take advantage of it.
Cengiz?
I agree. I think it's really difficult to tell, but there is also, as I said, in every challenge, there is also a chance. And I think despite social distancing and shutting down borders and locking us in our homes, I think we all see, even on the personal level, that there is the need for exchange and also meeting people. And I hope that this is also something on the we will see on the international level, that once this crisis is over, the states will come out from their national shell, and maybe there is a new spirit for cooperation as well. As we can see, we have been all affected in the same way. We are sitting across the globe in different cities, in home offices, and we all experience the same. And this is also maybe a chance to revive cooperation also on the international level.
Well, thank you very much, Dan and Cengiz, for giving us this tour d'horizon on what Europe looks like in the COVID crisis. And thank you for having this coffee hour with you. Take care.
Thank you.
Stay safe.
Thank you.